Good afternoon. We're going to take some time today to discuss the importance of increasing patient safety through increased compliance with hand hygiene protocols. We will discuss the why behind the importance of hand hygiene with the hopes that you'll take one new nugget away from our time together and implement it into your practice. Just a quick review on how we prevent the spread of germs in healthcare and keep our patients safe. I'll call it my three-legged stool. The first is compliance with hand hygiene protocols, making sure that we wash our hands at the right times. The second is wearing the appropriate personal protective equipment, such as protective gowns or gloves. This prevents exposures to germs. The third is cleaning and disinfection of the hospital environment and patient care surfaces. Germs live on surfaces, so we need to clean and disinfect them often. There are many other strategies in infection prevention, but these are three areas of practice. Without these three legs, the stool tips over. So in our case, that actually puts patient safety at risk. Of those three legs of the stool, the most important way to prevent the spread of germs is to perform hand hygiene, routinely and frequently. Cleaning your hands reduces the risk of spreading deadly germs to patients, reducing the risk of spreading germs that are resistant to antibiotics, and also reduces the risk of you becoming exposed to germs and becoming sick. If it's the most important way to prevent infection, why don't we do it? Let's explore. Is it the lack of education and awareness to the importance of it? Probably not. All healthcare workers are given education on the importance. Is it lack of product, availability of the alcohol-based hand rub, soap dispensers, or sinks? Probably not. If you look around anywhere in a hospital, there is alcohol hand sanitizer everywhere. Is it the lack of time or mindfulness? Many times we're already thinking about the next thing we have to do or not staying in the moment. Not performing hand hygiene is not intentional. Is it because the patient's immediate needs take the priority? Is it because our skin is irritated? Pretty likely in the wintertime when our skin is dry and cracked. If our skin is cracked, using the alcohol hand sanitizer makes our skin sting and hurt. I encourage you to think about the barriers you have to performing hand hygiene. What are some of the consequences of poor hand hygiene compliance? There are many. Increase in healthcare-associated infections affecting patients and staff, spread of antibiotic-resistant bacteria. Hospitalized patients are pretty sick and vulnerable and at an increased risk of developing an infection. Patient safety is at risk. Developing a healthcare-associated infection leads to a longer hospitalization and potentially increased morbidity and mortality. It could affect healthcare worker safety as well, as we are exposed to germs many times during the day. So let's take a few minutes to review when we perform hand hygiene. The World Health Organization describes 5 moments. Before touching the patient, I call that foaming in or going into the room. Before a clean procedure, such as giving a medication through an IV. After a body fluid exposure risk. After touching the patient, I call that foaming out as you exit the room. Or after touching the patient's surroundings, like a computer keyboard, the overbed table, or the side rail of the bed. So let's talk about how. There's 2 methods, actually. Let's review. Hand rubbing with an alcohol-based hand rub takes 20 to 30 seconds. You want to get enough product on your hands to cover all surfaces and rub between your fingers, your wrists, the web of your hand between your thumb and your index finger, your fingers themselves, and the backs of your hand. So that takes about 20 to 30 seconds. Sometimes people sing happy birthday. Hand washing with soap and water takes 40 to 60 seconds. The mechanics of hand washing are the same as hand rubbing, making sure that you clean all the surfaces of your hands, but then make sure you use a clean paper towel to dry them. So let's talk about the why. This is a case study from when I first became an infection preventionist many, many years ago, but the case brought home the impact of a healthcare-associated infection on a patient and their family. A 83-year-old male got admitted December 27th to room A after a fall with a left hip fracture. He went to the operating room on December 28th to have surgery on his hip. From December 30th to January 3rd, the patient in the room next door to him, room B, had an infection that causes diarrhea, and that patient was only there for 32 hours. Our patient acutely deteriorated. He developed the same diarrheal infection that the patient in the room next door had. And on January 4th, our 83-year-old patient died of the same infection. What were some of the contributing causes? We'll never know for certain. But did the healthcare workers perform hand hygiene after leaving room B before going into room A? Was there any shared equipment between room B and A? And if so, did the equipment get cleaned and disinfected between uses? We'll never know what the cause was. There's more to this patient's story. Our 87-year-old male, he was a lifelong Vermonter. He was a farmer, and he had tripped over his wife's cane at home. He had avoided healthcare his whole life. He was admitted to the hospital to have surgery on his hip, and he ended up dying of a preventable healthcare-associated infection. The case felt more personal to me as both of my parents are lifelong Vermonters and grew up on farms, and to this day, I still think of this case and its impact on my career. It is the why behind what I do. So in summary, remember that hand hygiene is the most important way to prevent the spread of infection in healthcare. What is one thing you can take away from today's presentation to improve your own practice? Take time to reflect and think about it. Thank you.